All right, good morning, everyone. Welcome to the Vitalist Grants 2021 information session. My name is Melanie Mitros. I am the Director of Strategic Community Partnerships at Vitalist. My colleague Kelsey Otten is also on the call this morning, as well as Jennifer Elmore, our Office Manager. Those two are great resources and assets to support us in these grants seasons and grant sessions as well. So just a few items of housekeeping. All lines are muted upon entering the webinar. This is to help us cut down on any background noise or feedback. Please use the chat function to ask any questions that you have throughout the webinar. The chat function will be monitored by myself as well as by Kelsey. So we have a couple of folks tracking what's going on there, as well as what I said earlier, that even if we do not get to all of the questions that are asked in the chat, we will make sure to circle back and get those questions answered for you. Additionally, these slides in a PDF format and the recording will both be available on our website by 5 p.m. on Thursday this week. This is the website location, vitalisthelp.org/grants. That's where all of our general resources about our grants are located. A little bit more about Vitalist. Our mission is to connect, support, and inform efforts to improve the health of individuals and communities in Arizona. A little bit of history for those who may not know us as well. Vitalist Health Foundation was formed from the sale of St. Luke's Health System back in 1995, late 1995, early 1996. So with that formed our endowment that we now operate from on an annual basis. So Vitalist is known as a convener, a framer, and a catalyst of key health initiatives, ranging from statewide health policy and systems change to the local development of community gardens. So we have our fingers in one or two different areas. These are our overarching goals: to improve access to care and insurance coverage, advance community policies and practices that result in healthy communities that are accessible to all, increase the capacity and effectiveness of community-based leaders, organizations, and coalitions, embrace and cultivate transformative grant-making, and increase civic help for inclusive decision-making to advance health equity. You can read more about each one of our goals on our website under the goals header. So the two grant types we're going to talk about today are our Spark grants, which started last year. These are designed to support collaborations in their journey to address systemic change, and our systems change grants. This is a renaming of our innovation grants that we renamed last year. And these systems change grants are designed to catalyze collaborations, working to transform systems through changes to policies and practices to improve the health of our communities. There's also a link to a one-page flyer that has general information about both of these grant types located at the bottom of this slide. So these are the basic qualifications for both of our grant processes. You need to be an Arizona-based nonprofit serving Arizonans. Fiscal sponsors are welcome to be the lead organization. And that's what's important, is that it's the lead organization that must be the Arizona-based nonprofit serving Arizonans. We have also worked with national nonprofits that have an Arizona-based chapter that does not have their own 501c3 status, and that is fine. We have no problem working in that capacity. We worked with the Nature Conservancy in that way a couple of years ago. We do ask that there is only one letter of interest per organization. I know for larger organizations like universities and county health departments and state health departments, this is a tough thing to manage. We did this last year. We actually had really good success with it. Please, I know it's a lot of work to do these conversations amongst yourselves, but we do ask that there is only one LOI per lead organization. An organization can be on more than one application, but those applications need to be different, and they cannot be the lead on each one of those applications. So with both of these grants, they do require partnerships. There must be two or more organizations or groups working collaboratively as partners. Now that doesn't mean that all, three of those partners have to be nonprofits. Sometimes they're coalitions, sometimes they're collaboratives, sometimes they're loose networks that are not as organized, sometimes they are nonprofits, and sometimes we even have for-profit partners. So please know that we do look at those partnerships as being very important, and sometimes diversity is a good thing with those. With both of these grant types, we are not funding existing programs. So if you have a great program, that's wonderful. We do not fund existing programs either for expansion or replication. We are funding projects that are addressing systems change. Now, one other piece with the qualifications is that a lead organization cannot be a current innovation or systems change grant awardee or a core partner of another project. With that said, if you are a current Spark grant recipient or partner, you are eligible to apply for the systems change grant. So those Spark grants, again, are designed to be a stepping stone. All right, here's our general timeline. This timeline is also available on the grants website. As you can see, we have our information meetings yesterday and today. Our posted materials will go to the website by Thursday this week. The submission portal will open for the systems change grant applications Thursday this week. Systems change letters of interest are due Friday, October 30th by 5 p.m. That's really important because the system will close down at 5 p.m. So if you're having issues, please let us know by email or by phone prior to 5 o'clock that afternoon. We do an invitation to submit full proposals in early December on the 7th. And then you'll notice the Spark grant submissions do not even open until January. So we do this intentionally, so letters of interest that come in through the systems change process we can take a look at and then make recommendations and invitations for Spark grant submissions later on. We do have a post-award engagement process with our systems change grant recipients. We'll talk more about those later on in today's presentation. All right, we're going to talk a little bit more about these Spark grants so folks can get an idea. So last year was our first year with Spark grants. We ended up awarding 9 Spark grants from 93 proposals. So with that, there was a lot of interest, and we have taken on a couple of additional projects this year in COVID response. So we are doing the Spark grants by invitation only this year. They will not be an open request for proposal process. These really are designed as planning grants. We recognize that systems change takes time. Developing those relationships and partnerships take time. So we're wanting to invest in that partnership and planning to support the development of those organizations and coalitions working towards systems change. They're smaller grants, they're $10,000 to $20,000 to be used over 1 year, but they really are to pay for people's time in this work to help offset staffing time, facilitator time, consultant time, stipends for community or residents to be able to actively participate in this planning process. These invitations will come from the systems change LOI process, as well as conversations with Vitalyst staff members. You will be notified by email by January 4th of that invitation. That's when that application process will also open. And then the Spark grant applications are due Friday, March 26th by 5 p.m. Arizona time. So these are the scoring criteria. These are the questions that we ask our reviewers to reflect on as they're scoring these Spark grant proposals that come in. So what is the readiness and capacity for partnership? How is the project approaching the work through an equity lens? How will the project make a significant sustainable difference in the future? So again, these are planning grants. They're not intended to necessarily make the impact right now. And how does the project address the intersection of 2 or more elements of a healthy community? We'll talk a little bit more about elements of a healthy community here shortly as well. So again, if you have questions about the Spark grants, please add those to the chat. If there's other questions, we'll answer them towards the end of the presentation. All right, I'm going to go ahead and keep us moving. So how do you determine who will be invited for a Spark grant? So as I previously mentioned, the Spark Grant invitations will come from systems change LOI process and from conversations with staff. So those invitations will come through direct conversations and the LOI process. And as mentioned in the qualifications are only current Spark grantees are eligible to apply for a different process. So this may be something we have to kind of talk through on a one-on-one basis. But typically, if you are a currently awarded grant recipient, we encourage you to wait. So if you're a current Spark grant recipient, you can certainly apply for a systems change grant. That's the intent. Spark grants would build into systems change. If you are a current Spark grant awardee, we would ask that you not reapply for another Spark grant unless it is something just entirely different space. But again, this will all be through conversation with staff as well as through the systems change LOI process. All right, if any other questions come up, please put those in the chat. We'll circle back and answer those questions here shortly. With the Spark grants, we awarded 9 last year, and we are intending to award approximately 10 this year. We have the same amount of funding for both our Spark grants and our systems change grants this year. So I'm going to move on to systems change to keep us on time. So systems change is shifting the conditions that are holding a problem in place. This is really important that we're thinking about as our systems change processes are moving forward. You'll notice there's a couple of links at the bottom of some of these slides. These are reference material that we often use. So we encourage you to take a look if you'd like to learn a little bit more about what we're thinking with systems change. All right, so seeing a system. Sometimes this is tough and it's hard to make that distinction between programs and working on systems change. So structures are institutional forces that shape the pathways. They include policies, laws, regulations, funding flows, and resource allocations, knowledge bases, cultures, and norms, and standard operating procedures. They form the institutional context in which pathways functions, and they influence the ability of individuals and organizational actors to build and maintain effective pathways. So you can see how these institutional structures, incentives, constraints, opportunities, they shape the different pathways, the capacities, and the connections that people have and that people are able to utilize, which then affect individual level outcomes. So we're really looking to work at that institutional structures level with these systems change grants. But what we believe is missing from kind of talking about this model of systems is the people that make up the system. So transforming a system is really about transforming the relationships between people who make up the system and the system. And bringing people into relationship can have a huge impact. So we want to take a look a little deeper into the 6 conditions of systems change. And I think this does a really great job of helping put these different pieces together. So this figure shows the 6 interdependent conditions that typically play significant roles in holding a social or environmental problem in place. These conditions exist with varying degrees of visibility to the people in the system, largely due to how explicit or tangible they are made to most people. So while these conditions can be independently defined, measured, and targeted for change, they're also intertwined and interact with each other. The interaction can be mutually reinforcing. The interaction can also be counteracting. Moreover, since the less explicit conditions are the most challenging to clarify, but can have huge impacts on shifting the systems, we must ensure that we pay sufficient attention to the relationships, the power dynamics, and especially the underlying mental models embedded in the systems. So for us, that's really important, these relationships, connections, and power dynamics. That's a lot of what's at play in those Spark grants. So really helping build that base of the relational change. And then the structural change is what we're working on in the systems change. But we know it takes a relationship across all 3 of these for true systems change to have a lasting effect. So a little bit more about Vitalist in this space. So the mental models conversation, I think, was a great way of being able to talk more about where we are in our journey as an organization. So in 2018, Vitalist embarked on a strategic planning process, which resulted in the development of short and long-term goals to guide our programmatic work. This was actually the first time we've done a strategic roadmap and made it public. So the 14-month journey included extensive board and staff work, as well as collaborative input and feedback from community partners statewide. The strategic roadmap below highlights the overarching elements that guide our work, as well as goal-specific objectives through 2024. So we really do believe that policy systems and environmental change are necessary, as well as a health paradigm shift. So this is the conversation around health is more than health care. But to accomplish these things, we need multi-sector partnerships and community-driven solutions. And to get those, we must have trust with collective power, and there must be equity. So here's our 2021 and our 2024 goals. As you can see, we really are working to shift those mental models. We want to see that people and organizations and groups move along the collaboration continuum. We're hoping that we're able to affect change in folks moving from resistant all the way up to champion. So by 2024, Vitalist will support stakeholders in building networks of collaborative health champions. Again, you can read more about our strategic roadmap at our link located here on the slide. All right, so our systems change grants. A change that is more effective, equitable, and sustainable than existing approaches. Systems change grants are designed to address one or more of the following items listed here. So we're looking for permanent shifts in system conditions that are more likely to be sustained when working at all three levels that we were just talking about. So explicit, semi-explicit, and implicit. So in doing that, we really have to increase community capacity to identify and address issues affecting community health and well-being, strategically leverage infrastructure, improve the environmental, social, behavioral, and health infrastructure conditions, and create a sustainable solution to the problem being addressed that endures after the term of the grant funding. So that's really what helps us make that distinction between a project with a systems change grant and a program that's ongoing and needs continued investment. All right, now we're going to get into the nitty-gritty about the LOI. Again, please continue to use the chat function to send questions through. We will do our best to answer those as they're coming up, and we'll also circle back at the end of the presentation. All right, so of course, there's systems change grants. So we have to talk about the systems change potential. So by definition, a systems change grant is one that is fully sustainable and not connected to grant funds or external expectations, but rather an organizational or cross-system priority to new policies, culture, communication, or practices. And this really is that distinction between a program and a systems change project. A systems change project is time limited and, if successful, is fully accomplished during the course of this grant period. So if it's a state level policy change, that policy is changed, in place, and moving forward. There's not additional funding that's necessary for the policy change to happen. There may be additional funding or additional actions that are necessary for continuation of additional work or whatever those other pieces following that policy change might be. There may be some things in there, and we're happy to talk about those in one-on-one conversations. So we're looking for those policy or practice changes that they can occur at all levels. They can be state, they can be national, they can be local. We typically do not see it at a single organization level. We really are looking at a local, regional, state, or national level for a specific population. I will say we got word last week from one of our 2014 Innovation Grant awardees that they were able to successfully get pediatric feeding struggles as a diagnosis. So it's now a pediatric feeding disorder. And they got CDC approval for being admitted into the next round of the ICD code book. which means that now pediatric feeding disorder is a recognized diagnosis with a code that can be billed for. And now our little kiddos who have feeding trouble are able to be diagnosed prior to failure to thrive. So really exciting work by our partners, Feeding Matters, and all of their colleagues who worked on that project. Now, not all of these projects end up working at a national level, so don't feel like they all need to reach that level. That was just one example where they were able to move forward. Really exciting work. So these are the questions that our reviewers will be using to guide their scoring on this section related to the systems change process. They're going to be looking for who are the different players in the system, what are the reasons for the current status quo, what's the readiness or the capacity for the system to change. So this is kind of the why now. Now, why is this the right time right now? What's the best strategy for influencing systems? How can we learn about what is working, what's not working? And is there a clear understanding of the human dynamics occurring within this system? The next piece is equity. Equity really is about the work. It is our work. It's a lens through which to view every opportunity, decision, or action. It's not an outcome. It truly is that lens that's applied to all of the different steps of the process in these grants. It's an approach to determining all strategies in the work. I love this graphic from Robert Wood Johnson. It's a great way to me to be able to depict equity versus equality. So equality is giving everybody the same thing, even when they might need something different to be able to be their best self and accomplish what their goals are. Versus equity is giving folks what they need. So they may need a tricycle, they may need a recumbent bike, they may need a smaller bike. So it's giving them what they need to be able to accomplish what they need. And that's really important when we're talking about health disparities and looking at different areas, that we need to make sure that we are providing what is needed versus giving everyone the same things. These are the questions that our reviewers will be using to guide reviewing the health equity section. And this truly is important for us. Are people who are impacted by this health outcome, as well as the systems change that you're proposing, not only at the decision-making table, but are they an active member and partner of this work? We truly want all of these projects to be do with projects. What perspectives are being engaged to identify the strategies? Do we have the experience to know the root cause of the problem? And this is really important. Like, how far down can you get in that root cause analysis? Maybe you use the 5 whys, maybe you use a fishbone diagram, digging in. Who are the different perspectives that you've heard from? Do you have lived experience at the table to be able to address and identify those root causes? The third section is community partners. So as said before, this is an absolute qualification. There must be multiple organizations, groups, coalitions working together on this systems change. Again, the primary applicant must be an Arizona-based nonprofit, or the fiscal sponsor must be an Arizona-based nonprofit, and that needs to be clearly defined. You need to clearly identify all partners, and then we really are looking at, does the applicant organization plus the partners have the experience to select a policy or practice change for the identified population? And this is important to think through, where's the lived experience in this space? These are some characteristics that we think are important related to partnerships, that they meaningfully engage key stakeholders from the beginning. They willingly share ownership and decision-making among partners, creatively use existing community resources and assets, and collectively practice testing and implementing solutions. There's a learning culture that when something doesn't work, you dig in, you figure out why, and then you apply that learning to your next try. The fourth section is sustainability. Having been a nonprofit ED, I hate the term sustainability and the question on any grant application. This is a tough one. And this is really what makes that distinction between a project that's addressing systems change and an ongoing program. If you need to talk about, we need to pursue funding from another grant source to be able to continue or expand the program, then that's probably looking at it as a program. Now, a project or a policy change within systems, that's a project. It's time limited. You have a start, and if you are successful, you have an end. Again, there may be ongoing work that needs to happen following that systems change. That's not in the context of what we're talking about within this grant. We do want you to be able to talk about the sustainability of the larger scale of the work beyond the context of the grant. Not necessarily like what grant you would apply for or exactly how that might work, but being able to talk about it in the context is helpful. And again, this is an LOI, so this is just the stepping stone. You don't need to have it all figured out at this point. The fifth section is health outcomes. So we're looking for clearly identified health outcomes to be improved by this systems change. Now, obviously, these health outcomes may not actually be what you can measure during the course of a 3-year grant process. These health outcomes may be 5, 10, 15 years down the road. But you do need to be able to articulate the mechanisms for how this policy or practice change is eventually going to improve the identified health outcomes. This is where something like a logic model might be helpful in talking through, short-term, mid-term, and long-term goals of a project and what you're hoping to accomplish in those different outcome phases. Please do not feel like you have to submit a logic model with your LOI. It's only 2 pages for the LOI, so no logic models submitted here. But they may be helpful in kind of sketching out and being able to think through your theory of change as to why you believe the systems change would have that health outcome impact. So I'm sure many of you have seen this graphic or others like it, which are really talking about that our health is determined by so much more than the health care we receive. While the health care we receive is absolutely critically important, it's one of our 5 goals that we focus on is access to care and coverage. We also recognize that there are many health behaviors, physical environment, and socioeconomic factors that have direct impacts on the health of an individual as well as the health of a community. And taking that a step further, we know that health behaviors are directly influenced by the accessibility to physical and socioeconomic factors. We often only get to make the choices that are available to us. So Vitalyst took this a step further in 2017 with our Year of Healthy Communities and really thinking through how could we have this conversation about social determinants of health or elements of a healthy community with everyone in our sector, throughout our communities. So if we're talking to a bus driver, or if we're talking to a light rail operator, we're talking to a housing developer, we're talking to a teacher at the school, or we're talking to the Arizona Department of Environmental Quality. How can we have the conversations and be able to bring these different elements together to talk about how health is impacted by the intersections of multiple elements of a healthy community? So this is important with these systems change grants because we really are looking at, we want to know what are the elements that you believe are contributing to this health outcome, and then what is the systems change that you're proposing to affect that intersection of those elements of a healthy community. You know that many projects will have multiple elements of a healthy community that are involved. Please do not feel like more is better. We do not need you to outline and say you're addressing absolutely every one of the elements of a healthy community. Please try your best to focus on the 3 or 4 that may be the primary elements of a healthy community. All right, the budget. So the LOI does need to include a couple of sentences that are a general overview of how much you're asking for and how the funds will be used. All of these projects are 3-year projects. The grant funds are $150,000 to $175,000 is the requested amount. That is the total amount That is not per year. I wish it was per year. Unfortunately, it's not. That is the total amount over the 3-year time frame. So we are looking to see that the request for funding is consistent with the proposed work, but that means you need to identify how that funding will be used for you guys. So funds can be used for personnel, consultants, travel, convenings when they're safe, food, evaluation. A lot of times with these systems change grants, you really need to explore developmental evaluation to be able to assess these types of projects. And then directly related to the project, any other expenses, operating, admin, indirect, any of those kinds of things that are related to the project, we want to make sure you incorporate those. We do not have a set indirect rate that we allow. We ask you to say what you need in those spaces. Although we do have, when we get to the full proposal process, when we do the line item budget, we do have language in there that we do not allow university indirect rates, but our grassroots nonprofits, we do encourage them to apply for what they need in that space. You cannot use the funding for capital expenditures to acquire or improve long-term capital assets, such as buildings or large equipment. Now, if you need an iPad or a new phone or something like that for the project, that's not a problem at all. Now, if you were going to outfit 40 people with iPads, that would be a different conversation. I would say that starts to edge into the capital expenditures. Again, for the LOI stage, you only need a couple of sentences generally outlining what you're anticipating the funding to be used for. Now, these are systems change grants. We're talking about policy work. We have funded work that's happened at the state level. So we need to talk about for-profit partners and lobbying. It is legal for nonprofits to do lobbying. It needs to be a minimal amount of their total budget that is the lobbying dollar amount. And we would encourage anyone who's considering applying that may venture into any type of lobbying, that needs to be a conversation with your CEO, with your board, to ensure that everyone is comfortable and approves what's going forward. Again, at this LOI stage, you may not need to have that level of detail, but it is a discussion, and it is very important that nonprofits understand what they are legally able to do. All right, these ideal projects we're looking for. So they result in a policy or practice change that improves the health of a specific population. Again, with the Feeding Matters example, these are kids and babies who are having difficulty eating. So it's a very specific population. They need to address the root causes or barriers to healthy communities. So again, the 5 whys or the fishbone diagram may be helpful. With the Feeding Matters example, they had great treatments, but the problem is that the treatments couldn't be paid for by insurance until a kiddo reached failure to thrive, which if you're talking about in a birth to 5-year-old, that's a really long time for a kid to reach that point. Versus now with pediatric feeding disorder being a diagnosis, they can start receiving treatments sooner, and more families now have access to those treatments. There needs to be a clear understanding and address the systems change at the intersection of multiple elements of a healthy community. So this was about access to care, it was about affordability, it was about nutrition, it was about several different pieces of those elements of a healthy community. And then the health equity lens must be applied throughout the work. So this wasn't the experts from the hospitals that initially were brought together around pediatric feeding struggles. It ended up being the parents, the grandparents that were observing their kiddos struggling eating that really ended up mobilizing this work. So it mobilized from those who were directly impacted by this challenge. Now, they did bring in experts, of course, and had lots of other partners and colleagues in that process. But the parents and grandparents and foster parents who had observed and were experiencing these feeding struggles were who were driving the work and informing the work throughout the entire process. So again, keep those questions rolling in through the chat. If you have any that come up, please feel free to add them. So next steps, we encourage you, but it is certainly not required to reach out and schedule a phone call or a Zoom meeting with either myself or another staff member. Some of these conversations may have already happened. Great, you don't need a separate conversation. And also, if you're already working with another Vitalyst staff member, please continue to do so. You do not need to switch over and begin working with me. It's completely fine to work with any Vitalyst staff member in this space. If you have not started a conversation, please feel free to schedule a meeting with me. I use Calendly just to make things a little easier in scheduling. The link again is available on our grants homepage, as well as will be available in the slide deck. All of these meetings are scheduled for 30 minutes. We typically have about 200 of these conversations each year. So it's really important that time is fleeting on our calendars. So we try to keep these meetings very focused to 30 minutes. We ask that you come in with one, maybe two projects to really dig into and discuss. These conversations are not designed to be, kind of tossing ideas out and seeing which ones make the most sense. At this point, we need to be digging into the specifics. As you're drafting your letter of intent, think about the alignment with our mission, the clarity of your policy or practice changes potential to improve community health, that you've clearly identified that policy or practice change and how it's addressing an intersection of two or more elements of a healthy community, so that healthy community wheel. That there's a clear identification of the system that you're working in, as well as the proposed pathways to change. There's description of how the project is using a health equity lens throughout the work. There's defined partners with experience in this space. That there's specifying the potential lasting health change, and that there's clearly identified health outcomes to be improved by the proposed policy or practice change. And again, don't forget those couple of sentences outlining your proposed budget. Here's a few tips. Be specific. Use the LOI as a stepping stone. Less is more in these systems change grants. And I say that in the sense of don't try to accomplish 50 things, even though we know there's probably 50 things going on simultaneously. Please stay focused on a single systems change that you're working to address. Now that said, if you are awarded a systems change grant, we certainly are flexible as times evolve and things change. Who knew that we were going to be dealing with COVID during the course of this year's systems change? We've had all kinds of pivots we've helped them make. They are still working towards their original systems change. The process of getting there just looks a little different. As a reminder, only one LOI per organization. The LOIs are due October 30th by 5 p.m. Here's a link to our online portal. Notification is made for requests for full proposal by December 7th. So follow the instructions that are available online. There's a one-page outline guide on how to submit an LOI on our website, as well as embedded in this slide deck. And there's screenshots on the next few slides that do walk through the online application process. If you submitted an application last year, you'll still use the same login information unless you've got new folks, and then they can set up new login information. Your LOIs must be only 2 pages. So I would encourage you to use the space for your narrative. We do ask that you copy and paste the narrative into a text box in the online submission portal. Figures, text boxes, or figures, tables, those kinds of things do not copy and paste well at all. So please stick to the narrative when you copy and paste. If you do have cited references and they run onto the 3rd page, that is fine, but know that the reviewers will only receive the 2 pages of the LOI. And please use single spaced, don't go down to like half spaced, and use 12-point font for our reviewers as well. Right, this is another timeline for you, so you can see these are the specifics just to the systems change. The previous one that you saw at the beginning of today's presentation was the entire systems change and Spark grants timeline. This is just for the systems change. And then as I mentioned with the systems change grants, we do have a 3-year engagement period after during the course of the funding. So it's a 3-year grant. We really are looking at investing in the individuals, the organizations, and the collaborations that are doing this systems change work. So these are quarterly capacity building and development sessions. We encourage 2 or more attendees from each project to attend. Typically, these sessions would be over lunch. We would provide lunch in our offices on Fridays. Unfortunately, we're not meeting in person right now, but we are still doing those sessions on Fridays midday. We do have a semi-annual reporting of outcomes, budget, and lessons learned. It's a pretty high-level overview of how things are going. This last year, for the annual reports, we did do those by Zoom and by phone call, and we are considering continuing to do those by Zoom and by phone call, as they really were an incredible way for us to learn at a totally different level about what was going on with these projects. All right, I'm gonna pause there, see if any other questions have come in. There was a question about schools. Yes, schools are eligible to apply. Nonprofits, traditional 501c3s are eligible to apply. Tribal organizations, tribal entities are able to apply. We currently are funding White Mountain Apache Tribe. It does typically take a tribal resolution for them to do their full proposal. It is dependent on the tribe for whether they need a tribal resolution for the LOI stage. Government entities can apply. I think there's been questions in the past about membership organizations. We typically have not, I don't think, had membership organizations apply. And that's I can't remember the 501c, which number for those. But they really do need to be eligible to receive charitable contributions. So typically schools, government, 501c3s, tribal entities are the main ones that we see come through. If you have a specific question about your situation, please feel free to send it through the chat directly to me or to Kelsey, and we can follow up on that. All right, I'm not seeing any other questions coming through. So I'm going to go ahead and keep us moving forward and talk a little bit about our grants management system. So if it's the first time you're visiting our grants management website, this is what it will look like. Again, here's those instructions on how to submit an LOI. If it's the first time you've come to our page, you'll click sign up. You'll put in your information, get an email back from the system, confirming your email address with a temporary password, and then you'll be able to sign in the next time and change your password. Once you're signed in, you'll create a profile. This profile part is really important for us. So last year, to the 2020 grant season, we started collecting diversity, equity, and inclusion information about the applicant organization as well as about the projects. So the applicant information will be collected on the account profile. It's really important. We're looking at who's leading your organization, those executive positions, vice president position, director positions, your board, who makes up those organizations. Now, that does not have a direct effect on who is being selected at this time. We are simply still collecting information and working towards being able to better utilize that information. Right now, again, we're still looking at our ground level of data. Who are we working with and who are we funding? So when you get ready to submit your LOI, again, there's screenshots of kind of what things look like. You also have that one-page PDF you can print out to be able to follow it step by step. I do strongly encourage that you not work in 2 different windows. Like, don't open part of it in a separate window. You may lose your work. You can certainly save your work and then come back, but your LOI will not be submitted until you click that final green submit button. So really important that that happens. All right, well, we made it through. Thank you everyone for your time today. I will stay online for a few more minutes to answer any additional questions that come in through the chat. We look forward to reading your LOIs.